Welcome to this plenary session. Before we begin, I want to set out a few points. This meeting will be held in hybrid format with some members in the Senedd chamber and others joining by video conference. All members participating in proceedings of the Senedd, wherever they may be, will be treated equally. A plenary meeting held using video conference in accordance with the standing orders of the Welsh Parliament constitutes Senedd proceedings for the purposes of the Government of Wales Act 2006. Some of the provisions of Standing Order 34 will apply for today's plenary meeting, and these are noted on your agenda. I would remind members that standing orders relating to order in plenary meetings apply to this meeting and apply equally to members in the chamber as to those joining virtually. The first item on our agenda this afternoon is questions to the First Minister, and the first question is from Delyth Jewell.
Will the First Minister make a statement on the projected cost of dualling the A465 between Dowlais and Hirwaun?
I thank the member for that question. The capital cost of completing the dualling of the Heads of the Valleys Road through the final Dowlais to Hirwaun stretch is £590 million.
Thank you, First Minister. When the project was signed off in the Stage 3 scheme assessment report in 2017, the projected construction cost was £308 million, with a total project cost approximated at £428 million. Recently, the Western Mail revealed something similar to what you've just said, that the cost of construction had now increased to, as they put it, £550 million, though I take the figure that you've just said as being £590 million. But what was really shocking to learn was that in moving to the mutual investment model of financing, the Welsh Government has now also committed to pay £38 million a year for 30 years as an annual service payment. That total cost of the annual service payment for the 30-year period will be an eye-watering £1.14 billion. That brings the total cost of the project to £1.7 billion over 30 years, being a £1.3 billion increase from the initial projection of £428 million. Let's call this insanity what it is, First Minister. PFI under another name. Spending £1.7 billion on infrastructure in the valleys is a great idea, but how about spending it on community regeneration, work creation schemes, public transport, improving housing and schools, rather than on what must be one of the most expensive roads per mile in history?
Well, Llywyd, that was less a supplementary question than a farrago of misunderstandings and misrepresentations. I'm afraid the member has no grasp whatsoever of the mutual investment model, a model, of course, adopted by the Scottish Government following the Welsh devising of it. So her sister party in Scotland has chosen to follow our lead in this matter. She mangles together a whole series of costs and fails to make sense of any of them. The money that will be spent through revenue after the road is completed does not simply service the debt, but it pays for all the ongoing maintenance of that road throughout the whole of its life. Those costs are incurred in any scheme of road building, but they are not as transparent and available for everybody to scrutinise as they are in the mutual investment model. The model that we have here in Wales is very different to PFI. I've discussed it on the floor of the Senedd with the leader of her party on a number of occasions when, for example, he asked me to explore whether or not the 15% equity stake we take in the companies that will construct the road could be extended. Those, I thought, were very sensible conversations to get the most out of the model. I'm afraid the member really does just need to go back, do her homework, and then we'll have a more sensible conversation.
Laura Ann Jones.
Thank you, Clarith. I'm with Delyth Jewell on this. I mean, news that taxpayers face an extortionate amount of money being spent on this dualling from Hirwaun to Dowlais after construction costs increased by 25% in less than a year are truly shocking. That's an extortionate amount of money to be spending on such a project. I completely agree with Delyth Jewell on that. This follows your breaking of a manifesto pledge to deliver an M4 relief road and the South East Wales Transport Commission being instructed not to consider another motorway to ease its proposals on the congestion on the M4. Given your government's appalling record What confidence can the public have in you delivering future transport infrastructure projects, such as the proposed Chepstow bypass, on time and within budget?
Well, some of the members, as I would have expected, really, has simply failed to understand that what the mutual investment model delivers for the Dowlais to Hirwaun stretch is a fixed price contract. So the risks are carried by the private sector contractor. They have to deliver this road on budget and on time. Otherwise, there are very significant penalties that lie with them and not with the public purse. That is one of the advantages of having devised the model in the way that we have, because it does provide the public with that guarantee that the amount of money that has been agreed with the company is the amount of money that will be paid, and if further costs are incurred, the risks rest with the private contractor and not with the public purse.
David Rowlands.
Well, I have looked at the mutual investment model, and I have to say that it has a number of advantages. First of all, it will help the government to bring forward this project much faster than it might have been able to otherwise. And we have to say there is no doubt that this stretch of the A465 is a vital infrastructure project. Together with the work being done in the Clidders Broad section, it will create a quality trunk road connecting the heads of the Valley's towns, west as far as Swansea and east as far as the Midlands, and even London via the M4. So does the First Minister agree with me that it will provide a particularly strong tool in getting businesses to locate along the heads of the Valley corridor and thus help to alleviate the economic underperformance of the area?
Well, I would thank David Rowlands for those points. I am very proud of the fact that successive Labour governments here in this Senedd have provided 13 continuous years of investment to complete the Heads of the Valleys road for the reasons that David Rowlands has identified. That it will bring new economic opportunities to those Heads of the Valleys communities. It will link them in a way that they've never been linked before, with a modern infrastructure, both east to the Midlands and west to West Wales. It is a vital part of this government's investment in those communities, and the completion of it in the Dowlais to Hirwaun stretch delivers on our commitment to those communities. And can I say that David Rowlands also made an important point. Were we not doing it through the mutual investment model, this road would not be going ahead. It's the only way that we are able to make that investment. And at a time when we know from last week's comprehensive spending review and the OBR estimates of what will happen to the economy next year, we need projects ready to go now. 1,000 people will be employed at the height of this road's construction. 120 apprenticeships, 60 traineeships, 320 internships for young people in that part of Wales where the advantages will be felt in those communities that need it the most. It's no surprise to me that the Tories oppose it. Of course they would. They have no interest at all in what happens in that part of Wales. But here on these benches, we are very proud indeed of our record of investment in this road, in those communities, and that's what this final stretch will deliver.
Alan Davis.
Grateful to you, Presiding Officer. First Minister, it's no surprise, of course, to see Plaid Cymru and the Tories ganging up to condemn investment in the South Wales valleys. I'm old enough now to remember it was a Plaid Cymru minister, of course, who held up investment in the Heads of the Valleys road back in 2007. And the road is there not simply to provide communications, but as a tool of economic development. And in supporting some of the poorest communities in the country, which we know that these people on my left have got no interest in, it's important to ensure that we have a jobs plan for the Heads of the Valleys to maximise the value of this public investment, so we can invest in people and places and the communities of the Heads of the Valleys. It's why they support us and why they will continue to support us, and not the noise coming from these benches. Well,
Llywydd Alan Davies is absolutely right. The road is not just a road in itself. It is all the economic opportunities that it will unlock in those communities. The OBR tells us, though, that next year unemployment is expected to rise from 4.8% today to 7.5%. That people in Wales will see a rise in unemployment from 70,000 today to 114,000 next year. I've heard the party opposite previously argue for investments that put people to work, that create opportunities for people and places. Here they have one where the work has already begun, where construction will begin in the spring, just when it is most needed, and they can't find it in them to say a single word in support of it. Luckily, we have members representing those communities here in the Senedd who will do that on their behalf.
Cwestiwn 2, Mark Isherwood.
Well, what analysis has the Welsh Government conducted of the impact of coronavirus-related poverty in Wales?
So we've drawn a wide range of research and analysis to understand the impact of coronavirus-related poverty in Wales, including work by the IFS, the ONS Labour Force Survey, the Resolution Foundation, the National Survey for Wales, the Citizens Advice Bureau and the Bevan Foundation.
Thank you. Well, Citizens Advice Cymru research Facing the Cliff Edge, Protecting People in Wales from the Financial Consequences of COVID-19 in May, stated that the Welsh Government must be proactive in encouraging people to check what benefits and support they're entitled to. This should include benefit and support schemes administered in Wales, such as the Council Tax Reduction Scheme and Discretionary Assistance Fund. The Bevan Foundation's September report, Reducing the Impact of Coronavirus on Poverty in Wales, stated that the Welsh Government should undertake a large-scale benefits take-up campaign to ensure people are accessing the benefits they're entitled to, including UK social security benefits, as well as schemes operated by the Welsh Government and local authorities, such as Council Tax Reduction Scheme, Free School Meals and Discretionary Assistance Fund, and establish a single point of access for free school meals, pupil development grant and council tax reduction scheme. What specific consequent action has the Welsh Government taken?
Well, Llywydd, I'm long used to the fact that the Conservative Party in Wales is an irony-free zone. But even by its normal standards, that supplementary question goes a long way to taking the biscuit. Let me tell the member what people will find in Wales when they go to have their benefit entitlement checked by the Citizens Advice Bureau using the single advice fund that we have provided. What they will find is that £1,000 is being taken away from the poorest families in Wales by the decisions of his government. That those people who have managed to keep their heads above water as a result of coronavirus-related poverty in Wales now find that they are going to be asked to bear the burden of the impact on our economy. I thought last week's comprehensive spending review, of all the many disappointments in it, the worst of all was the Chancellor's refusal to guarantee to those families that the £20 a week that they are getting now will continue to be available to them after the end of March next year. 35% of all non-pensioner households in Wales benefit from that. 30,000 families in Wales, according to the Joseph Rowntree Foundation. When, as the member asked me, people go to the services that we provide here in Wales to find out what they will be entitled to, the first thing they will learn is that this Conservative government has turned their back on them again.
Mary Jones.
Diolch, Llywydd. I know the First Minister will be aware from the research that he's mentioned of the disproportionate impact of COVID economically on women, and particularly single single-parent families, which tend to be led by women. The £500 payment that's available to people on low incomes who are self-isolating is very welcome. I'm sure it's making, and we know it's making a big difference and enabling people to self-isolate. But of course, that payment, as things stand, is not available to the parents of children who have to isolate or who are sent home because their colleagues are isolating. Speaking to a constituent the other day, she said to me, "What am I supposed to do? I know I shouldn't take my children to be with my mother because I know that isn't safe. They're supposed to be staying at home with me, but if I don't go to work, I don't get paid. If I apply for benefits, I'll wait weeks and weeks and weeks before they come through." May I ask the First Minister today if he will look again at the eligibility for this payment? We all realise that the Welsh Government doesn't have a magic money tree, but in terms of priorities, I hope that the First Minister would agree with me that enabling parents, particularly single mothers, to stay at home with their children when the children have to isolate is something that we should all work towards, because none of us would want to find ourselves in that position where we have to either be able to put bread on the table or to follow the rules.
I thank Helen Mary Jones for that powerful supplementary question, and she will note that her colleague Leanne Wood raised this issue with me here on the floor of the Senedd 2 weeks ago. I held a meeting with officials yesterday as a result of the points that had been raised with me, and work is being done to see whether within the financial envelope that is available to us we can respond to the genuine difficulties that are being reported. I know Helen Mary Jones will know that if a child has a positive test and has to stay home because TTP has asked them to, then the parent with care is able to claim the £500. The difficulty arises in the circumstances that were described, where children are sent home from school because another child in the class has been tested positive. Now, sometimes those children are back in school very rapidly. But if it extends to a full 14 days of self-isolation, that undoubtedly places extra financial burdens, especially in the families that Helen Mary Jones described. So my officials are working very actively to see whether it is possible to devise a way in which help could be provided to families in those circumstances, and I hope that ministers will see the result of that work before the end of this week.
Hugh Davis.
Diolch, Llywydd. First Minister, we know that the financial blow of coronavirus has fallen hardest on those who are already disadvantaged, and this has come on top of a decade of Tory austerity. But despite the efforts of Welsh and devolved governments to mitigate this, the impact cumulatively of UK government benefits cuts and delays and penalties has punished the lowest paid and the lowest income and vulnerable households. Now, the Conservatives promised us years ago that austerity would be borne by those with the broader shoulders, yet they loaded it on those already bowed down under debt and poverty. So, would you agree with me that Boris Johnson's proposals to cut universal credit, cut working tax credits and freeze public sector pay suggest that we are seeing the same old Tory party attacking the very poorest working families and households in Wales?
Well, what did we hear in the Comprehensive Spending Review last week, Llywydd? That the poorest people in the world will now face a cut in the aid that one of the richest countries in the world provides to them. A deeply disappointing day, as David Cameron, a former Conservative Party Prime Minister, said. That in this country, it will be the poorest people who are penalised when they don't have that lifeline £20 a week. And that the public servants who've been praised from the benches here throughout the coronavirus crisis for the way in which they have been on the front line, or refuse workers, or local authority workers, or teachers. How many times have I heard opposition party members here praise them for what they have done, only to find now that their reward is to be to have their incomes frozen once again. And it's not the first time, as Hugh Davis says. This comes after a decade in which those wages have been held back by successive Conservative governments, and here we see it again. Scratch them and you see what you get. They are a party who've always believed that the rich should prosper and the poor must pay the price, and here they're at it again.
Questions now from the party leaders. Conservative leader Paul Davis.
First Minister, in response to the Welsh Government's announcement that hospitality businesses will not be permitted to sell alcohol and that they'll have to close their doors at 6 p.m, John Evans, landlord of the Black Boy pub in Caernarfon, has said that, and I quote, "It's not fair on those many pubs and restaurants who have followed the rules and done the right thing. The loss of revenue will be astronomical. We'll have to throw beer and other stock away," unquote. In Cardiff, the general manager of the Grange pub, Di Dearden, has said the announcement was a hammer blow. And in Usk, Monmouthshire, Kelly Jolliffe, the owner of the Greyhound Inn, has said that she was gutted about the regulations. So, First Minister, what is your message to these businesses and plenty more across Wales whose livelihoods are at risk because of your decision to partially close the hospitality sector here in Wales?
Well, my message to those businesses is that despite all the efforts that they have made, and I recognise the enormous efforts that so many businesses have made, that we continue to face a public health emergency here in Wales. And that despite those efforts and everything else that has been done, the number of people infected with coronavirus in Wales is going up every day. That is translating itself inevitably into more people occupying hospital beds in Wales, more people needing critical care, and more people losing their lives. That is the inescapable context in which the decision is made. Having said that to people, that this is a public health emergency in which we have to act to prevent lives that can be saved and which would otherwise be lost, I would say to them that we have mobilised the most generous package of support for that industry anywhere in the United Kingdom. £340 million that will be used to assist that industry through the very difficult weeks that lie ahead. I understand the Prime Minister has announced £40 million today for the whole of England for the hospitality industry. There will be £340 million available here in Wales alone. And that is the other thing that I would say to those industries, that the help that they will get from the Welsh Government will be the best available anywhere in the United Kingdom.
Well, First Minister, the partial closure of Welsh hospitality is a devastating blow to the sector, and there will be pubs and restaurants in areas where transmission rates are low who will rightly feel upset that their businesses is being put at risk through no fault of their own, and in areas where there's no evidence that hospitality interaction is leading to an increase in transmission rates. The Welsh Government tell us that it was reaching out to the sector over the weekend, but it's clear that the views of the sector clearly haven't been taken on board, and many businesses across the country will simply not survive the winter. Therefore, can you tell us who you and your government met with over the weekend to discuss these proposals, and what discussions did you have about the partial closure of the sector, and how confident are you that this measure will reduce transmission figures and not result in people congregating in households and having house parties instead because they can't buy an alcoholic drink in a pub?
Well, Llywydd, people's lives are put at risk here in Wales through no fault of their own because of this virus, and I've been listening very carefully to what the member has said, and I'm sure eventually he will recognise that this is a public health emergency and that this is why these actions are being taken. I haven't heard him refer to that once in his questions so far. Over this weekend, ministers were in discussions with a whole range of different interest groups. We were talking with our local authority colleagues, we were talking with the trades unions, we were talking with the enforcement authorities, we were talking with the sector itself. There are no easy decisions here. There are no easy decisions of any sort at this moment. We looked very carefully at the Tier 3 restrictions in England, where businesses are closed completely. They don't open their doors at all. We looked carefully at the Level 3 restrictions in Scotland. We looked at the SAGE review of both of those approaches, and the SAGE approach suggests that there is no public health difference between the two measures. Both are successful. Because of that, we opted to follow the Scottish model, in which those businesses who choose to open will be able to go on trading up until 6 o'clock in the evening. And that was our decision in discussion with the sector to do what we could to balance the difficult balance between saving people's lives and having to attend to people's livelihoods. And the help we will offer to people whose businesses are affected will go beyond anything that has been on offer up until this point in Wales and beyond anything that would be on offer to them anywhere else in the United Kingdom.
First Minister, you've just referred to SAGE, but SAGE said in September that a curfew on bars would have a marginal impact on reducing transmissions. You say there is evidence. Well, if there is evidence, publish that evidence so that people can see the results of your proposals. And let's be clear, nowhere else in the UK, where hospitality businesses are facing these sort of measures on a national basis. Here in Wales, a pub will be open but won't be allowed to sell any alcohol, whether it's in Cardiff or Conwy. And do you expect these businesses to survive on pop and pork scratchings? Now, First Minister, Carlsberg UK have said this, and I quote, "Leaving pubs open but only until 6 p.m. with no service of a responsibly enjoyed beer or glass of wine shows a complete lack of understanding or respect for this crucial part of our society and the sector." And Alistair Darby of Brains has said that the new rules for pubs are a huge slap in the face for the sector. Of course, the Welsh Government must now ensure that business support is made available urgently and that it's accessible to those that need it. Now, you'll have to forgive businesses across Wales if they're not entirely confident that they'll get the help that they need. The shambolic handling of the Economic Resilience Fund Phase 3 must not be allowed to be repeated. However, we've just heard from your Economy Minister that businesses will not be able to apply for financial support until January. First Minister, that is simply not good enough. Do you seriously believe that businesses will survive this period, given that they will not be able to access support until January? And therefore, will you now reconsider this catastrophic decision and ensure that businesses get the help they need now and not in 4 or 5 weeks' time?
Well, Llywydd, I listened again to what the Leader of the Opposition said. I offered him an opportunity to recognise the public health emergency, the lives that are at stake here. And for the third time this afternoon, he failed to do it. It's all very well for him to sit there claiming that, of course, he believed it, but he could have said that, couldn't he? He could have said that. Instead, he acts as though this is a very easy set of decisions in which the balance that we have struck could have very easily have been made in another way. Let me just say this to him. Just as we want to reduce coronavirus infections to save lives, so reducing them is the key to saving the economy. Think for a moment what would happen to our economy if we allowed infections to reach a level such that our NHS was overwhelmed. Would families seek out crowded bars and buzzing restaurants if they knew they would be infecting friends and relatives who could not be treated if they fell ill? Would we flock to the January sales if the doors to our hospitals were shut? Not my words, but Michael Gove's words at the weekend. Michael Gove's words. You wouldn't recognise them, of course. But what Michael Gove was saying was exactly this, that unless you are prepared, there's no point in
Andrew Antidavis, this is the question from your party's leader. You don't need to be pointing fingers at the... I don't want fingers pointed, please, in this chamber. First Minister, to continue, please.
The balance we strike is always between saving people's lives and attending to their livelihoods. And that is the balance that we have struck in the package that we have announced over the weekend and then on Monday. The member asks about the help that has been provided to businesses here in Wales. 64,000 business rate grants have been awarded already to businesses in Wales, worth £768 million. In the 175 lockdown business fund, only available between the 23rd of October and the 9th of November, so a matter of just weeks ago, already 31,000 grants have been awarded to businesses worth nearly £100 million. Of course we will do everything we can. working with our hard-pressed colleagues in local government to get the help that we have announced into the hands of those who need it as fast as we possibly can. And most people who work in the sector recognise the scale of the help that is being made available to them, the efforts that are being made to put that help where it is most needed, and the fact that by acting in the way that we have, we are protecting both the health of people in Wales and the long-term prospects of those businesses.
Arweinydd Plaid Cymru, Adam Price.
As the most recent TAC report states, that the positive effects of the fire break have largely been lost. We supported the fire break on condition that lockdown wasn't the default strategy. We warned that the restrictions coming out of fire break needed to be stricter. That mistake and the continuing failure to sort out the testing system have led to yesterday's regrettable announcement. Yet again, the hospitality sector is bearing the brunt. Many businesses will not survive, and there is an understandable public backlash. Can the First Minister give us the detail of the scientific advice and evidence which underpins the decision to close cafes, restaurants and bars at 6 p.m. And to ban alcohol sales completely? And can we ask that this be published in full today? And can you say, First Minister, as well as looking at the Scottish Tier 3 model and the English Tier 3 model, did you also model a uniquely Welsh solution to balancing saving lives and livelihoods in a different way to the decision that you came to?
Well, what we have is a unique model to Wales. So it does not replicate either the English or the Scottish approach in full. We never intended to have a drag-and-drop approach from elsewhere, so you will see significant differences between the measures that we have here in Wales and those that are employed elsewhere. They are more generous in a number of ways. In the Scottish model, it is not possible for 4 people from 4 households to meet together in hospitality. So the member will find that there are very important differences designed specifically to meet the circumstances we face here in Wales in that very difficult balancing exercise. The science is already available to members. It was published by SAGE on the 11th and the 19th of November. It's referred to in our TAC reports already. It is the same science, Llywydd, that led the Scottish Government and his colleagues there to take the decisions that they took. It is the same science that was available to English ministers when they introduced Tier 3 measures in England. It is the same science that convinced our Chief Medical Officer and the Chief Executive of the NHS in Wales to recommend this course of action to the Welsh Government. There is no absence of evidence. The evidence is the same evidence that has led governments across the United Kingdom and indeed across Europe to take the actions that we are having to take. I'm a bit puzzled at the member's reference to the testing system, because the testing system here in Wales, since the 21st of June until the 21st of November, the whole of the period of our TTP regime, 98% of index cases have been reached, 92% of follow-up cases have been reached. Of those index cases, 87% of those successfully reached in the last week were reached within 24 hours. 80% of those contacts who were successfully reached were contacted within 24 hours. And last week, Llywydd, 91% of tests requiring a rapid turnaround were completed within 1 day. Now, that says to me that the system we have here in Wales is a successful and succeeding system, and part of that is because of the additional investment that was agreed for that system during the fire break period.
So public trust is being eroded because people don't understand the logic of the decision as it's currently being communicated. How can 4 people from 4 different households having coffee together be safer than 2 people from the same household having a pint? Why is alcoholic mulled wine served in the open air in a Christmas market a danger? This lack of logic risks undermining adherence overall, and there's a danger then that more people will be going into each other's homes as a result. Now, our alternative proposal would be to allow cafes, restaurants and bars to stay open until 8 p.m. with alcohol served until 7. This could follow stricter guidelines, which included limiting the number of alcoholic drinks with pre-booked table service only. The sale of alcohol could also be banned in off-licences in supermarkets after the 7 p.m. cut-off to discourage people from gathering in homes. Would you not agree, First Minister, that this would be a simpler, clearer and more consistent compromise that gets the balance right between the COVID and non-COVID harms as the latter become ever more evident the longer the pandemic persists?
Well, Llywyd, I think it is helpful to have different approaches and different ideas rehearsed. I think, though, that all that would happen would be that one set of anomalies would be substituted by a different set of anomalies, because there is no getting away from the fact that in the complex systems that we have to implement, there are always marginal things that can be pointed at and people can say, why is this allowed when that's not allowed? Why can't I do this when the evidence for this is that it is safe? Those anomalies are just unavoidable when you are trying to respond to the complexity of the position that we face today. The course of action that the member has advocated, which, as I say, I think is a useful contribution to the debate and thinking about all of this, would simply lead us into a different set of compromises, a different set of anomalies. There is no getting away from the fact that when you're trying to devise responses to the rapidly changing and very challenging set of circumstances we face, it isn't possible to have a logic that is watertight on every single occasion and in every single aspect. What we have to ask people to do is to take the package as a whole. And the package as a whole is designed here in Wales to put us back in a position where the numbers of cases of coronavirus can be coped with by our health service, that the health service can go on doing all the other things that we need it to do, where lives will be saved, and that is the prize that all of us have to keep in front of us.
While the additional package of financial support announced yesterday is clearly welcome, it does not fully compensate the hospitality sector for the lost revenue over the festive season. And there are other sectors which are continually being locked out of sufficient support. The taxi drivers whose trade in December largely depends on taking people to and from bars and restaurants, and workers in the gig economy reliant on seasonal work. For so many people, these restrictions as currently conceived are all stick and no carrot, and the support does not adequately compensate them for the loss of earnings. And, you know, we've had the announcement with Debenhams today, the announcement by Brains. Since the beginning of 2020, there's been a 41% increase in unemployment in Wales compared to 18% in England, meaning an estimated additional 20,000 people are looking for work. To protect jobs and in the interests of people's wider well-being and to sustain public trust in the overall public health policy, can I urge the First Minister to reconsider yesterday's decision?
Well, I doubt very much that reconsidering yesterday's decision would add to public trust. But what I can say to the member is, of course, he is right to point to the devastating impact of coronavirus in so many people's lives. The package of help that we have announced is not focused exclusively on hospitality itself. £180 million of it will be provided to those 8,000 hospitality businesses and the 2,000 businesses that support them in the supply chain. But the remainder of the £340 million package is available to help a wider range of businesses who are affected by the decision. And that includes retail businesses, where they can demonstrate that there's been a direct impact on their trading capacity, but it also includes sole traders as well. There is an important strand in the package that will allow cleaners, for example, who clean hospitality places. They're not employed by the business, they're employed by themselves. They will be able to get help from this package, as do taxi drivers. I met with a group of taxi drivers on Sunday myself. I was asked earlier which groups we had talked with over the weekend. I made a mosque visit myself on Sunday, expressly to meet with a group of people in the taxi trade, and they've had a desperately difficult time during this period. But there is help available to them, partly through the Welsh Government, partly through the UK Government, and this package goes on helping people, not just in hospitality, but those whose livelihoods surround it.
Question 3, Russell George.
George Lewis. Will the First Minister make a statement on community health facilities in Mid Wales?
Thank Russell George for that question. Llywydd, local services have made rapid advances in implementing key aspects of the primary care model for Wales. In Mid Wales, the Powys Health Board is progressing the Bro Dyfi redevelopment at Machynlleth and a new practice in Llanfair Cerenion.
Can I thank the First Minister for his answer? I'm aware of both those proposals. First Minister, I'm aware that Powys Teaching Health Board and Powys County Council have now formally submitted a bid for a new build health facility in Newtown. Now, the new build and wellbeing hub would be, of course, a huge benefit to thousands of people across North Powys. Now, if the Welsh Government approves the proposals, we could see a cutting-edge, state-of-the-art facility in Powys, which could offer more services locally and bring the latest technology and training to Mid Wales. The new facility would also allow, of course, for checks and appointments to be offered locally, rather than people having to travel out of county as they do now. I'm also aware, as you will be, that there's been a real difficulty in recruiting health professionals to Mid Wales, particularly GPs. So I do firmly believe as well that the new facility would encourage health professionals to locate to Mid Wales. So would you, First Minister, be able to confirm your support for this health facility to support the people of North Powys?
Well, so I thank Russell George for that, and thank him indeed for his support for the development at Machynlleth and Llanfair Cerenion, which I know he's on record as doing. I know that from a Mid Wales perspective, he will also have welcomed the fact that in a statement on the 16th of November, my colleague Vaughan Gethin was able to confirm that we've now recruited 200 GP trainees to Wales in the 3 rounds of recruitment in 2020. That's up from 186 last year, and it's well above the 160 target that we have set. And in the same statement, the Health Minister announced that we are going to continue to fund the Academic Fellow Scheme for Mid and West Wales for a further 2 years in an effort to respond to the point that Russell George made about the need to attract GPs and other health professionals into that part of Wales. The Newtown development is part of the 3 regional rural centres that the local health board have identified. The programme business case for the multidisciplinary campus at Newtown has been submitted to the Welsh Government and is being scrutinised by officials. As Russell George said, Llywydd, it provides for health and social care facilities, but more than that, there's a new primary school as part of the development, there's new housing in the development as well. It's therefore a complicated proposal, and funding from different streams will need to be brought together in order to be able to get the funding behind it. But it is a very good example, I think, of the work that Imaginative Health Board is doing, and I hope that people in Newtown take heart from the fact that they have both an imaginative, creative and, I think, effective set of proposals that are now coming to this point in their development.
Question 4 is withdrawn. Question 5, Rhyn ap Iorwerth. Will the First Minister make a statement on arrangements in the port of Holyhead after the transition period comes to an end?
Well, may I thank Rhyn ap Iorwerth for that question. The UK border operating model is a reserved matter, where that model has an impact on the functions of Welsh ministers and communities in Wales. We are looking to manage and mitigate its effect.
Brexit transition ends a month today, and the sheer shambles of the lack of preparedness has been laid bare, I think, by the apparent decision by UK government to take over the Road King truck stop in Holyhead to be used as a freight checkpoint from July next year. I'm told that 28 staff have been told they'll lose their jobs. And we need assurances that they'll be re-employed at the new border post. But whilst this might have helped resolve one piece of the Brexit jigsaw, it's created new problems because the truck stop was a vital part of the port's infrastructure, stopping trucks from having to park all around town. Now, what we needed was a new border development in the Holyhead area, but at this 11th hour, we're just seeing blind panic, I think, from UK government that's paid scant attention to the needs of Holyhead, and part of Holyhead's border infrastructure is still earmarked for Warrington, as far as we know. Can I ask what the Welsh Government knew about the Road King plans? And take us back to why it was decided that HMRC would take the lead on providing all necessary border posts and port infrastructure for Holyhead, because as I understand, Welsh Government could have had a role to play here. What assurances were you given by UK Government? And couple all this with the nervousness around the as yet untested new electronic checks on exported goods being introduced on January the 1st, we can see the risk Holyhead faces now. It's the best Irish sea crossing, and I get very nervous with all the talk of increasing direct freight between Ireland and continental Europe to avoid land bridge problems. So what steps can Welsh Government take now to help overcome these problems that remain and to stop Holyhead Port and ports jobs from being undermined?
Well, Llywydd, can I thank Rhys Ap for that question? It's 3.5 years since the Brexit referendum, and with weeks to go now, the state of preparation at Holyhead does indeed demonstrate just how shambolic the UK Government has been in delivering the outcome for which the Prime Minister campaigned. I sat in a meeting, Llywydd, in this building in July, the July after the June referendum, with the then Secretary of State for exiting the European Union, David Davis. The previous First Minister asked him specifically then about the issue of Welsh ports and traffic that comes from the island of Ireland through Wales. They've known about this problem from the very start. And here we are. The member has identified the site on the island that is apparently to be the UK Government's preference, but I've not seen them formally announce that as the location, even today. And of course, Rhys Ap is right. The electronic customs systems have even yet to be tested. Now, we first knew of the difficulties the UK Government was in when they shared this with us at the end of August. And that was because they'd failed to secure the agreement of the local authority to the plans that they then had in place for dealing with the impact of leaving the European Union on the port of Holyhead. Ever since then, we have worked with the port authorities, the local council, the Irish Government. The Irish Consul General to Wales is visiting Holyhead today, as I know the member will know, and with HMRC and with the UK Government to try to resolve some of those just intensely practical matters that they've had 3.5 years to grapple with, and still, at this very last minute, are in a scramble to resolve. It's just a sign of what is to come, and those who argued for it are responsible.
Question 6, Darren Miller.
Will the First Minister make a statement on NHS improvements in North Wales?
So the improvement in NHS services in North Wales has been evident in the coherent and comprehensive response of the Health Board to the coronavirus crisis. This and other evidence of improvement underpin the recent recommendation that the organisation should be de-escalated to targeted intervention.
First Minister, since the announcement of the de-escalation of special measures to targeted intervention, I've been contacted by many constituents who are frankly absolutely bewildered by the decision to reduce the level of intervention at that health board. You will be aware, because you put this health board into special measures, that at the time that it was put into special measures, there were serious concerns about mental health services and indeed in its relationship with the public. It was told that it needed to reconnect with the public, regain public confidence and sort out its mental health services. And yet, here we are, over 5 years on, still in a situation where public confidence is very, very low and where mental health services are still wanting. There isn't even the effective strategy to implement on mental health in order to drive those services up. Why is it that given the absence of evidence of improvement in mental health care, and indeed the absence of evidence in an improvement in the relationship with the public in particular, that this organisation has been taken out of special measures altogether?
Well, the organisation has been taken out of special measures, Llywydd, because the tripartite system that advises the Chief Executive of the NHS led him to recommend to the Health Minister that this was the right moment at which de-escalation should take place. That is a routine matter in the health services. Health boards move up and down escalation measures. In August 2019, Cardiff and Vale University Health Board was de-escalated to routine monitoring. In September of this year, Swansea Bay and Hywel Dda were reduced from targeted intervention to enhanced monitoring. The member may believe that his efforts in persuading people to take a dim view of the health service in North Wales have succeeded. But it hasn't succeeded amongst everybody. Unison, I was very glad to say, issued a press release on the day that the decision was made. This decision, it said, is a vindication of the hard work of every single healthcare employee at Betsy. Those people who have worked tirelessly to see BCU taken out of special measures. And more generally, Llywydd, more generally, the population in North Wales will know that cancer services in North Wales, both the 62-day performance and the 31-day performance, are the best in the whole of Wales. That the record number of GPs recruited that I referred to in my last question come as a result of the work done in Betsy to devise the new training module that has now been scaled to the whole of Wales. All the GP trainee places filled in Wrexham, in Bangor and in Dyffryn Clwyd. Professionals have confidence in the work of that organisation, even if the member does not.
Question 7, Laura Ann Jones.
Thank you. What measures are the Welsh Government taking to improve road safety in Monmouthshire?
Safety Framework for Wales sets out the actions we and our partners are taking to improve road safety in Wales. Monmouthshire will also benefit from the actions taken to roll out the 20-mile-per-hour speed limits on restricted roads and tackling pavement parking.
Thank you. First Minister, can you provide an update on plans to improve road safety on the A4042 in Llanelin? There's a spot where there's a humpback bridge over the Usk, and although there are footways leading up to the bridge on both sides, any walkers are forced into conflict with vehicles by having no option but to walk on the carriageway. This is the only section of the A4042 between Llanover and Abergavenny that has no footway. Seems bizarre, and I can't imagine if there are any comparable places on a trunk road in the rest of Wales. Local residents are complaining about the lack of progress and understandably frustrated by the delay. Some time ago, 18+ months ago, the Minister for Economy and Transport confirmed that options were being pursued for the pedestrian bridge at Llanelin, and measures would be taken to improve the safety of walkers. Just wondering if you could give us an idea roughly of how, or advise when the promised works to improve road safety will commence on this road. Thank you.
Llywydd, well, a safety and speed limit review was carried out across Wales in 2019. 413 sections of trunk road were assessed and 114 locations recommended for work over the 5-year programme. On the 4042, drainage work was carried out by the Welsh Government in May of this year. Again, a direct road safety issue to improve the difficulties which that stretch of the road had previously experienced. I'm not familiar enough, I'm afraid, with the specific part of that road to which the member refers, but I'm sure if she wishes to write to me or to the Transport Minister, we will be able to provide her with an update on it.
Question 8, Leanne Wood.
How is the Welsh Government tackling poverty in the Rhondda?
Thank Leanne Wood for that question. Llywydd, we tackle poverty in the Rhondda through a series of programmes which place or leave money in the pockets of those who most need it. Since April of this year, for example, the Discretionary Assistance Fund has made over 11,000 awards in RCT, providing £1 million to those who would otherwise have gone without.
First Minister, poverty was an acute problem in the Rhondda before the COVID pandemic hit. and things have got considerably worse for many people since. I know that because I run a food share scheme where demand is increasing, and it's relying on some fantastic volunteers to do some pretty essential anti-poverty work. And we also know that the situation is soon to get worse with the changes that will be made to universal credit. Now, Plaid Cymru believes that a universal income could be a way out of this. The current piecemeal system of grants and financial support has meant that many, many people have fallen through the gaps. Now, Westminster will not look at this. So would you be prepared to consider a basic income pilot? And if you would be prepared to consider that, would you consider a location for that to be in the Rhondda, in an area where need is clearly quite great?
Well, Llywydd, I thank the member for that question. I've always myself been interested in universal basic income. Again, I've discussed that with a number of members around the chamber here, and indeed I discussed it in some detail with the SNP leader of Glasgow Council, where an attempt at a pilot was being mounted. She described to me some of the real practical difficulties that there are, given the interface between a basic income provided by a devolved government and the benefit system. And I think that a pilot approach is the right one to try to be able to explore in a practical way what those barriers might be. Whether it is best to do it on a geographical basis or whether it is better to do it on a sectoral basis, choosing a group of people. That was the approach at the time that Glasgow was exploring. A particular group of people and then mounting a pilot scheme with them, I think, is something that we should debate and discuss further. And I also think, Chloe, that the whole basic income debate needs to join with those people who argue that a universal basic service guarantee would actually do more for people who rely on public services than simply a basic income. But this is a rich area for policy debate and exploration, and I think it would be very good if we were able to have that on a cross-party basis here in Wales.
Ac yn ola, cwestiwn now, Andrew R.T. Davies.
Thank you, Presiding Officer. First Minister, will you make a statement on the number of patients who have died in hospital after acquiring coronavirus?
So with neither the ONS nor Public Health Wales publish mortality figures on this basis. A comprehensive explanation of mortality data sources for Wales was set out by the Chief Statistician earlier in the pandemic.
Thank you for that answer, First Minister, and our thoughts are with all the families, obviously, who have lost loved ones wherever they are in Wales to coronavirus. But in my own electoral region, Cwm Taf Health Board has suffered a tremendous amount of death, regrettably, in hospital setting, and it seems to have gone through all the 3 district general hospitals that sit within that local health board. It is important that lessons are learned, and it is important that those lessons then are put into, what's learned from those lessons is put into practice. I cover the Cardiff and Vale Health Board area, being a regional member, and in that health board area, thankfully, we haven't seen such number of deaths in hospital. So there clearly is good practice going on in other health boards. What assurance can you give me that the lessons learned exercise that undoubtedly is being undertaken by Cwm Taf will implement more stringent control measures so that we do not see a repetition of the tragic scenes that we've seen at the Royal Glamorgan, Princess of Wales and Prince Charles Merthyr Hospital?
Shall we thank Andrew R.T. Davies for that. I agree with much of what he said. The deaths that we have seen from coronavirus in the community and in hospital are always an individual tragedy for families involved, and our thoughts really do need to be with them. For the week ending the 22nd of November, Public Health Wales data shows that 94% of all confirmed cases were acquired in the community and 3% of cases were acquired in hospital. But that does mean that hospitals have a particular obligation to make sure that they do everything they can to prevent the spread of virus once it has gained any sort of footing within a closed setting such as a hospital. We learnt lessons earlier in the summer, Llywydd, from an outbreak in the Wrexham Myla Hospital, and they have been advising colleagues in Cwm Taf as well. And the lessons that are being learnt there are being spread to other parts of the health service here in Wales. It's just an unfortunate and inescapable fact that as community prevalence rises, the chance of the virus getting into a closed setting, whether that's a care home or a hospital or a prison, rises at the same time. And in those communities where coronavirus has been in particularly violent circulation, that's certainly been true of RCT, then those risks are even greater. But learning the lessons from the experience and making sure that they are available to others who may face the same challenges is a very important part of the response, and very much, I know, part of the way that Public Health Wales and the specialists in this field are working together.
Diolch i'r Prif Weinidog.
Thank you, First Minister. The next item is the business statement.